Are you tired of that arthritis knee pain that just won't go away? In the past, surgery was the best option to eliminate the pain, but now there is a better option. Advanced Wellness System LLC is offering a non-surgical procedure that is revolutionizing the way knee pain is treated. And here with more is Dr. Brian Parris. I'm so glad you're here. I have that sound in my knees of like squishy, I don't know what. So tell me, what are my options that don't involve surgery?
Well, there's the first thing is to figure out how do you know if you have a problem with the knees. One is pain. Two, that aching that you wake up in the morning or you can't get up and down the steps.
Right.
Another one is that cracking when you can hear someone walking down the hallway.
Right.
So you know that you're a candidate. Primarily, this is a program focused on osteoarthritis of the knee.
Okay.
So the goal is to first find out if you have osteoarthritis of the knee. Pain is usually that #1 indicator.
And probably this time of year, people are all complaining about their joints and their knee pain because the cold is getting in there and you know when it's going to snow. But we're talking specifically about knee visco... See, I'm going to mess this up. You say it. What are we talking about?
Viscosupplementation.
Viscosupplementation. So is this sort of the goo in there that's keeping our knee
That's exactly
moving?
What it is.
Okay.
So when you look at a healthy knee, so when a healthy knee has cartilage all around the bones above and below,
okay,
that's made of
Let me
something
hold this
called,
for you. So
Thank you.
Okay, so we're talking about the blue part of this here.
Yes, and also within the joint, there's what's called hyaluronic acid.
Okay.
And there's hyaline in that cartilage. As injury occurs within a knee or other joints above and below, that knee can wear down. You lose some of that cartilage and the hyaline in the cartilage as well as the hyaluronic acid in that
Is this the
joint.
cartilage here? This
Yes,
little
that blue
okay.
part, and in here as well.
Okay. So when the knee breaks down, we lose all that.
Yes.
Now you've got a bad knee. Hand me the bad knee. Although I could probably just hold up my knee
Your own
to the
knee, right?
to the camera. But since we don't have the X-ray vision, this is see,
there we go.
You're the doctor, not me.
Yes.
So what are we looking at here with the bad knee?
So we're looking at the cartilage is worn down and this knee is real wobbly and very unstable. And you can see where any movements to this knee would cause a lot of pain and not let you bend down to pick up your grandchildren or go skiing or shovel the driveway, doing all those things.
Get out of bed in the morning. So what are our options to sort of reclaim that goo in the knee?
Well, the classical options are typically where someone will get a shot of cortisone first. Cortisone is very good for inflammation, but it's very, very dangerous for the actual bones themselves. You can only get a certain amount of cortisone in your joints or in your body over a period of time. So I like to go towards the more holistic realm. Now, this other option that you have is surgery, but our program really helps get into the knee joint so that you don't have to get surgery, or we can prevent that total knee replacement or other types of surgeries.
Okay.
The way the program works is that we have an injectable of hyaluronic acid that goes within the knee, and we couple that with knee bracing as well as physical therapy to strengthen the knee joint as well as the joints above and below.
And how is this different from other things that sound similar?
Very important because many clinics and many programs just focus on the injections themselves.
Okay.
We found that without strengthening and changing lifestyle and looking at the entire chain of how the body moves, you're missing out on a big portion of that process.
So the alignment of the whole system.
Correct. From the amount of weight you have, the amount of weight you carry, the way you can move, the way you're breathing, the way your whole body functions.
This is the time to do it. It's part of that New Year's resolution. You want to lose weight, you want to feel better.
Certainly.
Align the whole body.
Certainly. One of the coolest parts, too, is that it's covered by Medicare. It's FDA approved, as well as most major medical insurances.
Excellent.
Yeah.
So how much are we saying this is going to maybe cost us? It depends on our coverage?
It's really different for each person, but primarily it's fully covered by an insured plan and Medicare as well.
Excellent. What's the perfect age to come in for this, or pain level?
Well, I think the most important part is to figure out if you do, in fact, have osteoarthritis. So you need the proper diagnosis, which we can do on site, or talk with someone's physician to see if they are right for this program.
Where's your office?
We're in Rockville, Maryland.
Oh, so you're very close.
Yes, super
And we
close.
don't have to walk there with our bad knees. We can just drive to
Hopefully,
you.
after you're done with our program, you can walk around and
Perfect
feel
time
good.
in spring.
Yes, for the spring.
So what's the recovery time? So if I go in, let's say today, if I come in today and you say, okay, let's do this.
Well, it's actually, it's an injection only plus physical therapy. So you get very local, not even just skin anesthetic. So it feels like just getting your blood drawn, a very simple shot or injection. So the recovery time is very, very minimal compared to a total knee replacement or other types of surgery. So you're back on your feet super quick, and typically after the first or even second injection, you're feeling a significant amount of relief in the knee.
Excellent. Thank you so much, Dr. Brian Pearce, for telling us how we can feel relief in our knees finally.
Yes,
I look forward to seeing it. More Let's Talk Live is coming up. Stick with us right here.